Simulation mannequins are the new age of nursing curriculum and nursing theory and practice. The students are not just learning on paper, they are now learning in the hospital setting, which is in our sim rooms.
Learning in the classroom, you are studying it and it's very cut and dry, but in the simulation you learn how to react to certain situations without knowing anything beforehand. You know about your patient, but you don't know what you could come into, and you can't tell what patients are going to say, what their family members are going to say, what doctors are going to say.
Our program has the highest tech simulators. We have 2 3G mannequins who do everything a patient does besides get up and walk. They bleed, they sweat, they blink, they convulse. They do everything that a real patient does do, and the student is really, it gives them the opportunity to feel what it's like to take care of a patient.
We had a sim patient screaming in pain on a 12 out of 10 pain scale, and after assessing her vital signs, we administered the morphine that was ordered, and within 2 seconds her vital signs dropped and she was experiencing symptoms of morphine overdose. So we had to think fast and on our feet and give Narcan to help correct the overdose.
We have a sim child, a sim baby. We have 2 vital sim units who are not as high tech, but they do provide the basics. You can listen to lung sounds, bowel sounds, heart sounds. They do speak, so you can put them in a scenario. And the great thing about the vital sim units are that you can throw them in situ. So you can put them on a stretcher and bring them into the classroom, and the student can learn and do a simulation right there impromptu. The unique thing also with simulation is that the student is allowed to be brought into a safe learning environment, and their capacity to make mistakes is manageable in a simulation room.
In critical care, we had a sim patient that was on a mechanical ventilator and his vent was failing. So we needed to collaborate with the nursing team, the intensivist, and the family members in order to really get this patient back to where he needed to be stable. So I learned a lot about collaborating as a nursing team and not just one-on-one.
We have an ICU room where we have a simulation baby. So we simulate the NICU, the neonatal intensive care unit. We also simulate the adults or medical ICU.
Throughout every simulation, we had comfort in knowing that our professors were in the control room overseeing everything.
The feedback we've received from our clinical partners with our nursing students is that their confidence level is something they haven't seen before, and their therapeutic communication skills are stellar, and that they're able to really care for the entire family dynamic in that patient in that clinical site. And that's the result of simulation-based education.